normal cells in the body when they divide and form new cells, as the number of new cells increases, there is a contact between the newly formed cells, and this very contact between the newly formed cells becomes an inhibition for the process of cell division. So, cell division, it is a signal, so cell division stops. This is known as contact inhibition. Contact inhibition. But in malignant cells or cancerous cells, when they divide, they do not show this property. Cancerous cells not only differ from the normal cells in their structure and function, they also differ from normal cells in this unique property. They do not show contact inhibition. Therefore, cell division goes uncontrolled. Depending on the tissue, where this uncontrolled cell division is going on and malignant tumors are being formed, 4 types of cancer are recognized, namely carcinoma. The word carcinoma is used for cancer of the epithelium, surface epithelium. Cancer of the epithelium. So, for example, skin cancer, cancer of uterus, colon cancer. These are some of the familiar examples of cancer of the epithelium, carcinoma. Another type is called sarcoma. Sarcoma is the cancer of muscle and connective tissue cells. For example, bone cancer is an example for sarcoma. Another type is called lymphoma. It is cancer of the lymphatic tissue. Cancer of the lymphatic tissue. A common example is a cancer called Burkitt's lymphoma. And another type is called Leukemia. Leukemia is cancer of leukocytes. Abnormal increase in the number of white blood cells from the normal number of about 10,000, it may go up to 1.5 lakhs or 2 lakhs. This is what is commonly called blood cancer. The cancer causing agents are called carcinogens. Carcinogens can be physical. For example, exposure to UV and similar radiation can cause cancer. Carcinogens can be chemical substances. For example, nicotine present in the cigarette smoke is a potent carcinogen. Carcinogen can be biological. There are cancer causing viruses. For example, Rous sarcoma virus. So they can be physical, they can be chemical, they can be even biological. The genes responsible for this condition, they are called oncogenes. Oncogenes. Everyone has these oncogenes, but when these oncogenes go out of control, cell division goes out of control and leads to cancer. It may be due to physical carcinogens or chemical carcinogens or biological carcinogens. Treatment or therapy, there is a common line of treatment called chemotherapy, use of certain anti-cancer drugs which may prevent metastasis, but chemotherapy has a lot of side effects. For certain types of cancer, radiotherapy is employed by giving controlled doses of certain radiations. The malignant tumor can be dissolved provided the tumor has not undergone any metastasis. If it has undergone metastasis, radiotherapy will not be of any use. Sometimes exposure to such rays may itself induce the possibility of malignant cells. And another line of treatment is, of course, surgery. Wherever possible, if metastasis has not been initiated, the tumor can be surgically removed. If metastasis has already occurred, then even surgery will not be of much use. In the recent years, new lines of treatment with the help of biotechnology, treating cancer with monoclonal antibodies, another new line of treatment is called immunotherapy. In the recent years, using biotechnological procedures, new lines of treatment are being tried. Use of monoclonal antibodies, immunotherapy, and many such methods are now being tried on cancerous patients, and new drugs are also being tried.